Well, those deadlines are fast approaching for certain frontline healthcare workers to get vaccinated, both in Quebec and British Columbia. With thousands of them not fully vaccinated yet, there are fresh concerns that this could lead to staffing shortages. CBC's Sarah Galashan joins us now with more on what experts are saying could be a risk and the reward for some of these vaccine mandates. So let's talk about that, Sarah. What are we expecting?
Right. Well, so what we're expecting to this issue of mandatory vaccines for healthcare workers to go to court in Quebec as of tomorrow. A group of unvaccinated nurses is bringing forth a legal challenge. They're calling on a judge to put an emergency hold on the suspensions that are due to kick in as of Friday in Quebec. Right now, we understand, some 25,000 healthcare workers in all fields, everything from ambulance workers to long-term care workers to midwives that are not fully vaccinated. And if they are not fully vaccinated by Friday, then that is the deadline for them to be suspended without pay. And assuming that many people cannot become double vaccinated by Friday, there's been a real scramble to try and find people who would be able to backfill, to fill in these potential gaps. The government and organizers have been calling on retired nurses to come forward and people who could, as I say, fill in, and offering bonuses anywhere up to $12,000 for those who would be able to help as of Friday in the event that they do face what is anticipated to be a shortage. So far, the government has held firm, saying that this is an issue as they see it as patient rights. And as for the union representing healthcare workers in Quebec, for their part, they have concerns not just for those workers who would be suspended without pay, but also for those workers who are fully vaccinated, who will remain on the job, who have been working so hard throughout this pandemic to make the system work. A system that has been, as we know, very stretched at times, and what this shortage could mean for those workers and how much more effort would be required of them. I want to play you what we heard from the union representing the healthcare workers.
There are very definitely consequences that we have to look forward and try to minimize. First of all, on the service level, but also around the whole organization of the workplace, which was already stressed very much so.
As for BC, the deadline for long-term care workers in this province to be fully vaccinated, that was tomorrow. BC was the first province to announce long-term care workers would have to be fully vaccinated. But that deadline has now been softened. As of tomorrow, long-term care workers in British Columbia will have to have received one dose and have a second dose within 35 days. There is concern in British Columbia as well of a shortage, particularly in the north, where vaccination rates are lower than elsewhere in the province. In terms of all healthcare workers, there's also a mandatory vaccine mandate coming for them, but that is not until later in the month, October 26th. Natasha?
Okay, so let's talk about the situation in Ontario, because it is somewhat different. In some cases, healthcare facilities are taking matters into their own hands.
We saw that last week with the Windsor Regional Healthcare Hospital, taking matters into their own hands. They laid off suspended without pay 57 people. That was on Thursday. And the Chief of Staff spoke with CBC's Rosemary Barton over the weekend about the fact that he really feels that that's something that should come from other levels of government and not individual institutions. But let's play that.
I do think it's unfortunate that we as a healthcare organization had to make this move and take this step on our own. I absolutely believe that this is something that should be mandated at a higher level, whether that's provincial or federal, to protect the individual organizations from some of the blowback that we've been feeling. The vocal minority is quite vocal, and there have been, threats to some of the senior administration. There's been property damage.
For Ontario, there is no mandate for all healthcare workers, but there is a mandate coming for long-term care workers in terms of them having to be double vaccinated. That's not until November 15th, but give you a taste of what might be to come. We know that there's a long-term care facility in Toronto that earlier last week they had set their own deadline, and when that deadline was not met by a number of people who worked in that facility, they were forced to suspend some 36% of their workers without pay. That happening last week. So that could be a taste of what's to come. Alberta certainly watching what's going on across the country right now because of course, their situation in their hospitals right now. They are stretched beyond their capacity. October 31st is the deadline they have set for all healthcare workers to be double vaccinated. scary not because it's necessarily Halloween, but we know they have, Natasha, the lowest vaccination rates in the country. We don't know what that means in terms of actual healthcare workers being double vaccinated in Alberta, but they are certainly going to be watching very closely how other provinces handle this, because they can't afford to have, obviously, a shortage of healthcare staff, particularly in Alberta, but really no province can at this point.
CBC Sarah Galashan. Thank you, Sarah.